Hi viewers, today our topic is pneumonia. Definition of pneumonia is, it is defined as inflammation of the lung parenchyma. It is a serious infection or inflammation of the lungs. Maybe it leads to pus formation in the lungs also. And coming to incidence, it is mainly caused by virus and bacteria, and more common age group is 5 years age group or below 5 years age group are the more common affecting for this pneumonia. And classification of the pneumonia is mainly it is dividing into three types, that is anatomical basis, etiological basis, miscellaneous. And coming to anatomical basis pneumonia, that is three types: lobar pneumonia, interstitial pneumonia, and bronchopneumonia. And coming to etiological basis pneumonia, that is bacterial pneumonia, viral pneumonia, fungal and protozoal pneumonia. Coming to miscellaneous pneumonia, that is aspiration pneumonia, primary atypical pneumonia, low effluence pneumonia, hypersensitivity pneumonia, and hypostatic pneumonia. This is the classification according to the anatomical basis of the pneumonia. This is the lobar pneumonia. This is very important, lobar pneumonia. Lungs are having mainly 5 lobes. In this each lung, 2 lungs we are having, each lung is having some lobes. Okay. So this type of pneumonia is affecting only for the lobes of the lungs. Not full lungs are affecting, only some part of the lung only affecting. That's why it is called lobar pneumonia. The main cause to organism for this lobar pneumonia is pneumococci bacteria. And second one is interstitial pneumonia. In this interstitial pneumonia, there is a full part of the lungs are, especially in the tissues of the lungs, are affecting for the pneumonia. Bronchopneumonia, both lungs are, 2 lungs are affecting for the pneumonia. In the lungs especially, we can see these patch-like structures in the lungs. Classification according to the etiological basis, mainly it is bacteria or viral causes, fungal and protozoa. Maybe it is bacterial pneumonia. Examples are staphylococcus and streptococcus bacteria is the main causes for this pneumonia. Viral pneumonia is mainly caused by coronavirus also. Fungal pneumonia is caused by aspergillus, and protozoal pneumonia is caused by Ascaris lubricoides. And coming to miscellaneous pneumonia, it is aspiration. Especially in the newborn baby and infants, leads to the aspiration pneumonia because of during the delivery or before the delivery also there is a chance they can swallow the amniotic fluid inside. And sometimes the baby is passing meconium inside of the uterus only, they will swallow this meconium, leads to aspiration pneumonia. Primary atypical pneumonia, it is mainly caused by the lower lobes of the lungs, caused by the Mycobacterium pneumonia. Low effluence pneumonia is mainly caused by the parasitic pneumonia. The examples of parasite is Ascaris lubricoides. Hypersensitivity pneumonia is mainly caused by which person is having the hypersensitivity because of any dust, any allergic conditions, they are having this hypersensitivity pneumonia. Hypostatic pneumonia is mainly seen by the bedridden patients. It leads to collection of the fluid in the dorsal part of the lungs. Coming to pathophysiology of the pneumonia is due to any causes. What we are discussed the causes, etiological causes, any causes or any bacteria or virus, any allergy, any causes leads to virus is entering into the respiratory tract and into the lungs. After entering to the lungs and respiratory tract, it reaching to the alveoli. There it is starting the multiplication, development of the virus or bacteria, their family. And there is a development of the alveolar phagocytosis and leads to inflammation of the bronchioles. Inflammation and infection leads to destruction of the healthy cells in that particular parenchyma places. There is a damaging of the parenchyma tissue, leads to pus formation in the lung air sacs. Finally, the person will get symptoms. So, main symptoms, how you can identify the person is having pneumonia. It is 2 symptoms, initial symptoms and severe symptoms. Starting pneumonia also they will get some symptoms. You can identify maybe chance this is the pneumonia. What are the initial symptoms? Maybe the person is having cough with thick sputum. You can suspect the person is having pneumonia. Fever with chills, anorexia, increased respiratory rate, rapid respiration also will be there. Irritability, sore throat. Coming to signs and symptoms, severe pneumonia. If the person is having severe pneumonia, cyanosis also will be there. Bluish discoloration of the skin. And wheezing sounds while taking inspiration and expiration. And chest indrawing also will be there. Convulsions, groaning, grunting sounds, murmuring sounds also will be there during while taking breathing, and pleuritic pain on breathing also will be there. Inability to take feeding. Coming to diagnostic evaluations, for all conditions, history collection, you need complete medical history you have to take from the family and from the person. Sputum culture test you need to do, complete blood count, pulse oximetry you have to provide, and endoscopy of the lungs. Coming to management of the pneumonia, mainly you have to go for antibiotics based on the cause to organism. If it is viral cause or bacteria and fungal causes, based on that you have to provide the medical management. Examples of antibiotics like penicillin, amoxicillin, azithromycin, erythromycin, like that you have to provide. And supportive therapy also, you need oxygen administration in case of severe respiratory problems. The person is unable to take breathing and cyanosis, immediately you have to administer the oxygen. Antipyretic, based on antipyretics, because the person is having fever with chills, provide antipyretics drugs. Fluid administration also important. Warm environment you have to provide. And diet, suctioning of the secretions also important. Provide steam inhalation. And coming to nursing management, already you know that you have to go for physical examinations, auscultation, percussion, inspection methods, and provide the general nursing care, check the vital signs, and continuously you have to monitor the patient condition. This is about the pneumonia.